right time, in right quality, and in right quantity. Okay. However, grows a different risk, and risk create a vital role to reduce consistency of improvement of such management system. Therefore, supply chain risk management is important to study and apply in organizations involved within supply chain. And this figure illustrates the process of risk management, which begin from identification, assessment, mitigation until the monitoring and review activity. Okay. And this is the flow of supply chain of pharmaceutical products in Indonesia that which begin from initial supplier to provide raw material, and then the product will distribute to customer through distributor, sub-distributor, and retailer. So the next, this is the process flow of JKN medicines management. So in JKN system, non-branded generic medicines will be used in this health insurance. So first, in the flow is Kemenkes will prepare formulas which contains a list of selected medicines and guaranteed by the JKN program. Then Kemenkes also collect drug demand plan called Rancangan Kebutuhan Obat or RKO, and also determine the estimated price called HPS as reference during bidding process. Next, RKO and HPS were submitted to National Procurement Board or LKPP. And then LKPP will help open bidding or close negotiation to determine the winner to provide the medicines item. The item winner will, which pass the administrative, technical, and price assessment will be published in e-catalog. So therefore, health facilities could purchase the medicines through the e-catalogs. And then Kemenkes, LKPP, and BPOM will monitor and evaluate regarding to this process. And here are some literatures which uh, related to supply chain of pharmaceutical industry. Okay, so this research was conducted by collecting the risk associated with pharmaceutical industry by based on scientific publications such as Scopus, Science Direct, and Google Scholar. And here are the list of experts which validate the collected risks. And here is the methodology process, which begin from literature review, and the validate risk will be conducted by expert validation through questionnaire and interview. Okay, so from the finding shows that 35 risks involved in generic medicine supply chain uh, and spread in these 9 categories. So the first category is demand risk, which have 5 sub-risks in it. However, in Indonesia, forecast error often occur due to inaccuracy of RKO. And then the next category is supplier risk, which have 4 sub-risks. And then the third one is transportation risk, which include the damages during transportation and handling, delay delivery of material or product, accident during transportation, and shipping error. Meanwhile, the fourth one is information flow risk, which have 3 sub-risks, and this information flow is important for coordination and collaboration among supply chain partners and are needed to make right decision at the right time. Okay, so in the financial risk, uh, the fifth category. Financial risks are something that supply chain often faces. From table 1 in the previous section, it could also be seen that financial risks have become the focus in the most study of pharmaceutical supply chain risk management. The next category is quality risk. So in the upstream, such as contamination and poor quality, defective material should be blocked. Meanwhile, in downstream, such as recall, responsive action should be done when discovering potential product harm crisis. And the next category is inventory risk, which have these four sub-risks. And the two last categories are production risk and external risk. The production risk could disrupt the flow of goods and can cause delay in production process, thus can fail to meet the targeted quantity. Okay, so from this study, we can infer that supply of generic medicines are important, remembering that JKN health facility use generic medicines. Risks occur in generic supply chain activities can hinder the availability of and also detrimental to both the patients and supply chain actors. Therefore, risk management shall be conducted. And from this study, we can see that demand, supplier, transportation, information flow, financial, quality, inventory, production, and external are considered as the risk affecting generic medicine supply in Indonesia. However, the study doesn't provide the occurrence probability, severity, or frequency of occurrence, thus cannot measure the impact of the risk. Therefore, it is important to assess the risk as in quantitative or semi-quantitative way and also study the relationship among the risks. So we can in the more probably in the next research, the risk mitigation strategies could be made. Okay, and here are the references. Thank you for your attention.
All right, thank you for the presentation. Before we continue, is there any question again from the floor first? This is such a good presentation about the just a preliminary phase, right?
Yes, just identification process actually. Yeah.
It's just a part of identification process. Any suggestion from the floor, or if you don't have the question, it's also okay if you want to suggest something to contribute to her study. Okay, I think Rina Fitriana would like to ask.
All right.
The time is yours.
Okay, thank you, Sukma, for the presentation. Do you mind to go back to the risk management area from your paper, from your presentation?
Where?
The risk,
Which?
about risk management. So all right.
This one?
Oh, okay, yeah.
Uh-huh.
So this one is you take the methodology based on literature review and then discussions and interview with the expert. Am I right?
Yes, you're right.
Oh yeah, because I just want to know, do you make the risk management based on the hazard and also on the risk assessment from the supply chain management?
Pardon, based on what?
Hazard identification, for example, or the potential risk for every supply chain?
No, actually, I just collect the risk from some literatures. Actually, about more than 10 literatures, and then I categorize the risk, and then I validated through the experts. They validate the risk that I collected before, and also they also categorize the risk, make some revise if I wrong in the categorizing process, and they will just validate it.
So after publish the paper, do you have any plan to make some kind of mitigation for this risk management?
Yes. So after this study, I will assess and make mitigation strategies about this risk which have been collected. Yeah.
Okay,
Thank you. Thank you
yeah,
for
because my paper is about the risk management as well. So yeah, okay.
so because yes. Thank you.
Thank you.
All right. Thank you for the question. Any other question or inputs for Sukma Aza? Linda Watu?
Can I
Mhm.
ask a question to Sukma?
Yeah, of course.
So as you mentioned in your presentation, so can you go to the conclusion maybe?
Mhm. This one?
Yes. So
Yeah.
risk you mentioned in your paper like demand risk,
Mhm.
supplier related risk, transportation,
Mhm.
and many more. So by your opinion, maybe which one is the first to be solved based on that same risk? Which one is the important one?
I think all the risks are important, but maybe because it is a non-branded generic medicines, which will claim by JKN program, maybe from supplier or supply, and then from production and financial risk will be more affecting the supply of generic medicines because, for example, from financial risk, exchange rate are the greatest issue. Remembering that 90% of active pharmaceutical in the ingredients supply depends on import. Uh, Thus, it can make the manufacturer could could be so the manufacturer will be hard to realization their uh, in the bidding process. Usually the manufacturer have a very low price, so the probability of the to win is higher. So if the exchange rate increase, it can affect their manufacture production process. Maybe that's the answer. Maybe yeah, that's all. Thank you for your question.
Yeah, okay.
Is that sufficient for you, Linda Watu?
Yeah, I think that's enough. Thank you.
Oh, okay. Thank you for your question. Any other question first? Okay, I think because of the time limits again, we must end this presentation. Thank you again for Anissa to present the paper. Sorry, Sukma Aza for
Yeah.
the papers
Okay.
about risk management.
Thank you.
To the next paper. The next paper entitled as the purpose framework of vaccine supply chain risk management in Indonesia. I think it will be fruitful for Indonesia when the vaccine for COVID will be distributed, right? So you will give the big contribution on it. I hope so. Okay, please present by the Anissa Khairani Sudarmin. The time is yours.
Thank you for the session, Chair. Good afternoon, everyone. Today I will present to you our study, and the title is a proposed framework of vaccine supply chain risk management in Indonesia. Next. This one is the outline of this presentation, and the first one is next introduction. Next. So vaccines are one of the most successful discoveries in the world. The World Health Organization reports that the vaccine succeeded to prevent around 10 million deaths in 2010 to 2015. And then vaccine contain temperature-sensitive antigen from microorganisms. So vaccine must be stored at least 2 to 8 degrees Celsius for frozen setting sensitive vaccines, and about minus 25 to minus 15 Celsius degree for heat sensitive vaccine. And a cold chain system that requires a strict temperature is needed in the vaccine supply chain, because improper storage in temperatures can reduce or even eliminate the potential of vaccine. And the negligence to follow cold chain standard in the vaccine supply chain could harm the patients. But unfortunately, negligence in vaccine supply chains often occurs even in the various countries in the world. Next. Sorry. These are some cases that related to vaccine supply chain that can or already harm the patients. In 2017, the vaccine in Ukraine hospital were not always stored at an appropriate temperature, resulting in a measles outbreak in there. And in 2018, a biotechnology company in China didn't follow the standards for child vaccine production and even falsified the production records. And in the recent 2019, a clinic in Australia kept the vaccine at the wrong temperature, and around 30,000 patients who have been vaccinated there since 2014 were revaccinated. And the last in 2014, damage to vaccine temperature monitoring equipment in Micronesian hospital has led to the spread of measles in there. Next. Okay, in Indonesia itself, there have been some vaccine-related cases that could endanger the patient, as happened in Semarang. In Semarang Public Health Center, which didn't monitor temperatures during the holiday and didn't perform first in, first out, or first expired, first out arrangement in the warehouse. And then in Manado Public Health Center, didn't use a cool box or cold pack in distributing the vaccine to the treatment rooms. And all these incidents are related to the negligence in the vaccine supply chain. Vaccine supply chains around the world face significant barriers, and these barriers have hindered efforts to control, eliminate, or eradicate the disease. An effective vaccine supply chain and logistic system are critical to maintaining the product quality. Vaccine supply chains are essential. Therefore, a risk management framework in the vaccine supply chain is needed. Next. Next is supply chain risk management. Next. Okay, supply chain risk management is the activity of identifying, assessing, treating, and monitoring the supply chain risk. This activity is using internal application tools, method, and also have external cooperation and collaboration with all members in supply chains. Supply chains risk management aims to diminish vulnerability and ensure sustainability combined with profitability to generate competitive advantage. Next. Next. There are 4 phases in here. Sorry. And the first is risk identification. The purpose of this risk identification is to find all suitable risks and be aware of uncertainties in the future so that we can manage them. This phase is crucial for the success of supply chain risk management, because only by identifying the risk we can trigger the risk management activities. Therefore, risk management must use a broad approach in identifying all possible menace and susceptibility in the supply chain. And the second is risk assessment, which generally covers qualitative and quantitative aspects. This risk assessment must consider the consequences and losses inherent in the case of the assessed risk, such as reputation, credibility, and status. It is crucial to have comprehensive understanding of risk in the supply chain context, not only for assessing direct risk, but also investigating the possible cause of risk. Next is the risk treatment. There are 5 most common strategies in risk treatment, which are acceptance, avoidance, transfer, sharing, and mitigation. But the topic is more focused in risk mitigation. The related actor actively mitigates the risk, trying to reduce risk to an acceptable level. These mitigation strategies are usually qualified for risk with strong possibilities and weak effect. And the last is risk monitoring. Actor must monitor the actor must monitor risk continuously to assess how the source of the risk develops and whether there are changes in the implementation of the treatment strategies in the future. And risk monitoring depends not only on test evaluation, but also on the formal procedure. Next. Next. Okay. This study present the initial stages of supply chain risk, which is risk identification. It begins with finding and collecting the risk from literature review, such as from Science Direct or Scopus. And the keyword used in the searching is vaccine supply chain management, pharmaceutical supply chain management, vaccine risk, supply chain risk management, and pharmaceutical supply chain risk management. And the next step is discussing with expert. Sorry, there is a little bit misplaced in this slide. I'm sorry for that. And the last is the risks are validated by the experts. Next. Okay, the experts who fill the questionnaire are stakeholders in the vaccine supply chain. These are the stakeholders in there. Next. Okay, the literature review resulted in 31 elements of risk in the vaccine supply chain, and the experts agreed to erase one risk and add 3 risks as the result of the questionnaire. Okay, and this is the risk element related to the supply and supplier category. If supply chain and supply and supply risk category, can you go back? Sorry. Next. Okay. If supply and supply risk occur, it can lead to inaccurate in estimation, increase in cost and time, excessive deficiency, and procurement vaccine overstock or stock out. Next. These are the risk element in operational category. Next. And this is the financial. An effective and efficient supply chain includes broad integration between finance and planning. Also forecasting, production, and procurement process to create a smooth system from the upstream to the downstream. Next. And then this is the demand category and also the, other category. Next. These are related to the logistic category. In this category, there are geographical barriers. Poor road condition in developing countries cause damage to the cold chain, and unreliable transportation can lead to the depletion of vaccine supplies in health facilities. And next. Okay, the last one is the conclusion. Next. Vaccine is essential, and there are so many risks that may occur in the vaccine supply chain. So a risk management framework is needed. This study presents the initial stages of supply chain risk management, which is risk identification. From the literature review, we got 31 elements, but the expert agreed to eliminate 1 risk and adding 3 risks. So we got 33 in the end. And the last is the study of this framework requires further research related to the risk assessment, risk mitigation, and risk monitoring, so that it will becomes a complete unitary framework. Next. Next, okay, these are the references. And then next, thank you for, that's all for the presentation. Thanks for your attention and good afternoon.
All right, thank you for the presentation from the audience. Is there any question? This about the risk, right? Making a list of the risk. I think our output should be the risk list.
Yes, there are risks in
The list of risk, right?
yes, yes, and the last and the presentation gives the list of the risks based on the category. There are
Okay. So your aim is to categorize the risk, right?
categorized, yeah.
Okay. Sukma Aza, I think will have the question, right? If you have the question, please, Sukma.
Yes, I have a question.
Yes, please.
So in this pandemic due to COVID-19, is the supply chain of vaccine in Indonesia encountering difficulty, and which risk could be involved during the pandemic? Thank you.
Okay, actually, maybe this is the vaccines, not the COVID-19 vaccines, right? Because
Yes.
as far as I know, it's still in the clinical stages.
Yeah, I mean vaccine in general,
Okay.
not the COVID-19 vaccine.
Okay. As I really don't know the exact impact in Indonesian vaccine supply chain, but as far as I know, I already read an article that around about UNICEF article that which states that since the corona pandemic, several flights and shipping lines were stopped. So it affected the vaccine delivery from the manufacturer to the health facilities. And then the lockdown policy also affects that the immunization process as uh, because the output of the vaccine supply chain is immunization to the patient. So corona impact the immunization process, and then and I read about other article that predicts that there are the disruption in this disruption uh, increasing the infant mortality because there is disruption in the immunization process. That's as far as I know.
Okay, thank you.
All right. Is there any other question from audience? One thing that I interest that you are make a categorization of the risk vaccine supply chain, right? Like I mentioned before.
Actually, I read many literature reviews and that literature reviews already categorized that, but some I already categorized, but some of them not. So I adding to the one from one literature to and other literature to the one category.
If you add some things into the category, then you make a verification, already make a verification and validation about the risk factors that you add into the categories.
Maybe can you repeat?
Okay, if you are adding some risk factors in the listed categories, have you done the verification and validation?
Yes, I already
you have already
validate the risk to the experts that in and they are the works in supply chain, vaccine supply chain. The first is the one who works in vaccine manufacture in Indonesia, and then there are two from distributor, and then there are about two from the hospital, and one from the lecturers. Actually, I already
How you do the validation process? I
by
mean, the method
by
you adopt some methods to do the validation, or
by giving questionnaires.
oh, I see.
About
You just delivering the questionnaires and you measure it.
yeah, I give them the questionnaires, and I actually ask them if there is any addition, and they validate by giving agree or disagree.
How about the verification process? Did you have done the verification process also? Because it's important if you are adding some factors into the categories and you are not doing the verification and validation.
I'm not adding, but I'm not adding, but maybe so there are already categories in the literature review in the literature. So I just give I just list that, and then give them to the experts to validate.
You don't do the verification. I think you will need to verify it also, because sometimes, okay, it is a validate by the actor. Some actors can validate there is a valid factors, but you need to verify it. It is will run well, or it is will it will be used as general. I mean, at any kind of vaccine, or maybe only on the specific vaccine, because the actors or the expert, I mean the expert only on specific vaccine industries, so it will not be used for a general one. I'm just that.
Actually, I make this a general one because only one vaccine manufacturing in Indonesia, so I make this for general, not specific to one. But maybe I have to verification.
Yeah, I get what you mean, but that's why what I'm afraid for, because you are only take a sample from one kind of manufacturing, you cannot say that it is can be used for general, right? Because there is maybe another type of risk that exists in the specific types of vaccine. I mean like that. That's why I need to make sure that you are also make a verification and validation process well, because you are trying to add some factors. It's just not a question actually, it's just an input for you. Okay?
Okay. Thank you for the
maybe
input.
any others from the floor? I think that's enough. And thank you once again for your presentation, Anissa.
Thank you very much.
And we will move to the next presenter, Alan Akbar Bukhari, with the presentation title, Pest Control and Palm Oil Plant Disease by Application of Expert System. Please, Alan, present your presentation.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. Introduce my name, Alan Akbar Bukhari, and today I want to discussion Introduce my name, Alan Akbar Bukhari, and today I want to discussion about the control and palm oil plant disease by application of expert system. The palm oil industry is an industry that has great potential of the international market based on the Food and Agriculture Organization of the United Nations 2015. It is known that the volume of palm oil production increased significantly. In 1995, palm oil production amounts to 15.2 million tons. In the years of 2012, increases to 20 million tons. And in the years 2017, the increases is 41.98 million tons. The increases is due to the many use of palm oil that can be processed to cooking oil, diesel, film mixture, actually for butter, and other. Next. Next, please. The lag demand will expand the area of oil palm growing. Sorry. Left. Okay. Growing activity, commodity whenly and monoculture is very like to attack disease in plant. Plant disease in the feed can be based on the symptom of the disease. Signs of disease are part of pathogenic microorganism that can be observed with the ordinary eye that characterize the type of cause of the disease. Next. Based on research by the following, all plant expert is a pest that has the potential to damage plant and have an impact to reducing crop productivity. There is rot, fruit branch borer, boot rot, rot handing, and others. Next. This type of research is survey research, which survey of the incident of oil palm plant that are attacked by pests and disease in the feed, interviews with oil palm farm, and interview with oil palm plant expert. The feed survey aim to determine the level of pests and disease attack on oil palm farmers land. Will interviews with farmers are internet to information about disease management or control system that have been carried out by farmers. Interviews with palm oil expert oil to find out the types of disease and pests that can the productivity of palm oil fruit. Next, please. Making a mobile-based expert system application with the best term method to get a conclusion of pests and disease surveyed by plan the their verification expert system that will be built like expert in getting conclusion from the problem that exit with the expert of each expert before this expert system was implemented, where some data that were used as knowledge base, namely symptom data, disease data, and biosteroma value data. Next, please. Conclusion, and one, an expert system to diagnosis pest and disease of palm oil has been successfully built by applying to trauma bias method and can provide information to pest, their probability, and based on symptom answer by the user. Number two, tracking the symptom of pest disease using the theorema bias method, where the method is able to diagnose a pest based on the symptom that exist in oil palm plants. Number three, in the day expert test, it can be concluded this expert system can be well verified by user and by expert. Okay, thank you.
All right, thank you for your presentation, Mr. Alan. Any question first from the audience? It's talking about the pest control and palm oil disease application by expert system. What do you mean with the expert system, actually, Mr. Alan?
What?
What do you mean with the expert system? What kind of expert system that you will try to apply?
Bisa diketik, Mas?
Wait a moment then. Maybe the question first from the while waiting for the master to type it.
Okay.
The question from the audience first. And solving the pest control and palm disease problems.
Yes.
No. You can see at the notes from the co-season chair. Have you have the message?
Yes, message. Okay.
So what do you think?
Sistem pakar. Provide solution for improvement.
Sorry?
Provide
what kind of the
ini digunakan untuk solution, but nothing pakar you use in mobile, your application it installed to mobile Android. You can to answer is mobile application, but nothing is pakar. Around the field. You can use application to find a repair solution.
So actually, I'm asking about in expert system, there are several methods, right?
Uh,
In
do
expert
you
systems, there is several methods that you can adopt. Which methods that you try to use to solve your problems?
I want to use method theorem bias.
Okay, Bayes theorem is the mathematical models. Actually, I don't got the idea what the Bayes theorem do in your systems, that's your suggested system.
But theorem bias, if answer to question by 1-to-1, but a question to answer this one, you choice yes or no. But you can choice question that apart in the application the application, the amount of which is correct, which uh, is right, which is wrong. Jadi so the expert system application will provide question to provide solution based on event.
So the input will be the event, right? So let me conclude that. Maybe correct me if I make a mistake then. So you want try to diagnose what kind of disease in the plants based on the symptoms, right? The event symptoms that occur in the plants, right? By adopting the naive Bayes algorithm to your proposed methods. Is that correct?
You can please.
Okay. I just want to conclude from what your explanation that you are trying to use naive Bayes methods, or you are called as the naive Bayes methods, right? In order to analyzing the symptoms to detect what kind of disease that the plant has, right?
Oh, all right.
Okay, so the question is how accurate bias to
but
predict it?
I made a program for Teroma bias. So the program that I built can be installed to smartphone.
Oh, so you're continuing making a program that
Yes.
can be injected into the smartphone application, right? So you're trying
Yes.
to developing the application.
Hmm.
The application is not exist before.
What?
There is no such that application before.
Application not.
So you are trying to make it online on the smartphone, right? So you are trying to develop the application, not trying to solve the case.
But application for the apa namanya? Enter the use sensor. Use sensor inject to smartphone. Cannot use share smartphone viewers to online.
Okay, so you built the application, or you are trying to develop the sensors, or you are trying to develop the methods. What you do actually in your research?
I'm so research to method and applying to data sensor to get data sensor applying to method.
So the input will be the data sensor. You are not making a sensor, right?
Okay, right.
Okay, you are not making a sensor. So you are just trying to use the data using the Bayesian methods, right? You mentioned as the Bayesian methods, right?
Yes, yes.
And then you are trying to predict the disease based on the symptoms.
Yes.
It?
Yes.
Okay.
All right.
It will work well on your application?
What?
Work well? Is it work well on your application?
Sensor in use smartphone.
Yeah. I mean the application can predict well the disease. Can your application predict the disease based on the symptoms well?
Applicationnya.
Your application, you make application, right? You're making an application, right?
Yes, I make.
Making an application, and you're trying to use data from the sensors to predict the disease, right?
Oh, this yes. All right.
Yeah, and then my question is, how well the prediction?
Oh, kita apa namanya? Based on restriction, batasan dari data sensor itu bisa dimanfaatkan untuk
All right, maybe I just suggest you an inputs then. For you, I think it will be better if you are trying to develop an application, you're trying to predict, right? To predict the disease based on the symptom, what I get from your presentation that you should try to quantify the prediction, whether it is your method is fit enough to your case or your application is good enough for your case to solve it, because you need to justify it. I think it's important things in making or developing the application, so you can have the judgment whether it will be goes very well or goes smoothly on your cases or not. I think it's an input for you then. All right.
All right.
Okay, thank you for your presentation because our time is up.
Thank you.
Before we end this session, I would like to ask you to turn on your camera because we need to screen capture all of the presenter as the proof. Okay, already, all of you?
Wait.
Except the assistant, actually. Okay, my assistant will be screen capture the picture. Ready? In 3, 2, 1. Okay, one more time, I think. 3, 2, 1. All right, thank you. And I think this is the end of our session today. Thank you for your attendance and thank you for your presentation. Hopefully you can gain the benefits session and see you at the next APCORISE in 2021 if you want to join our conference again, because we are doing it annually. So it will be APCORISE in the next year in 2021. So see you later. And once again, thank you for attending.
Thank you.
I will end this meeting.
Yeah, thank you.